Hello, Norwood. If you don't know me already, my name is Kevin Broderick, and I have a public access show called The Kevin Broderick Show. Today, we're interviewing Kathryn Ahnger-Pier about the election for the Board of Health, which will be on April 6th, this year, of course. Also, the Selectmen's debate will be on Tuesday, March 31st at 5 p.m. live, so stay tuned for that. And I hope you enjoy the show. Let's turn to the interview right now. Hey, Kathryn, thank you for being here.
Thanks for having me.
So the first question I want to ask you is, why are you running for the Board of Health?
Sure. I believe very firmly that I should give back to the community that I live in. And with my particular set of skills and experience, Board of Health just makes sense. I am a 12-plus year public health professional. I've worked in local and state health departments. Very familiar, love the field. And I feel like I can bring some fresh ideas and perspective to a board that hasn't seen any change since 2010.
And if you could describe in your interpretation what the Board of Health is responsible for and what your role would be if elected.
Yeah, so the Board of Health ultimately supervises the workings of the health departments. Generally speaking, on a day-to-day basis, they're not super involved. That goes through regular town structure. But the Board of Health generally says, here's some programs that I'm interested in, here's feedback monthly from the activities of the health department, and they are also responsible for the regulatory side of things. So local regulations around the health for the community, different housing or other investigations that might come up. If there's a hearing that's involved, they would be the ones who would be involved with that.
And given those responsibilities of the Board of Health, what would you say, I know you touched on it a little bit, your experience and how that would translate well into that position? Absolutely.
So I have a lot of experience with regulatory reform, again, locally, state. I also, I'm a epidemiologist by training. I've done a lot with disease investigations. I've done a lot with restaurant compliance. And I'm very familiar with what the day-to-day work of the health department is. Most of my local experience is actually pretty divergent. I worked in a small town and I worked in a big city. So there's a lot in between, which is where Norwood falls. But with a small town, you do a little bit of everything. I worked in Carlisle. There's a lot of septic tank, and septic tank siting is a really big deal. It's actually something that happens in Canton. I watched their last meeting in Canton, and they talked a lot about where people can put a septic tank. And I'm really happy we have MWRI. We don't have to worry about that as much. But there's also just a lot of very hyper-local things that impact one town versus the other. And I think that I've lived here, I think, long enough. I know many people would say I'll never be from the town, but I've lived here for the past 11 plus years. And yeah, I think I've got the experience and the knowledge that would be helpful to hit the ground running.
Yeah, and don't let anybody tell you that, because there's a lot of people, they frown on you if you weren't born in the town, but I don't think it matters too much. What local experience do you have outside of say your work experience in the health department in various capacities, but say on a broader town level, what have you been involved in?
Sure, I've been a member of town meetings since 2019 and really appreciate all the work you do with running around the mics until recently. And I am currently the chair of the town meeting rules committee. And in addition to sort of that public sector side, I've also been involved with Impact Norwood. I've been in their community coalition since about 2022 or thereabouts, and then I've been on their steering committee since 2024. I also sit on the Norwood Public School Health Council, also since 2024.
Gotcha, and we're the same district for town meetings, so that's
yes,
pretty
we
cool.
are.
District 9. Getting back to the race, what would you say distinguishes you from your opponent?
So I would say my inherent background, my opponent has been on the Board of Health for the last 30 years. Aside from that experience, I don't think she has other work experience in the field, whereas I've been working and living this for the last almost 14, 15 years at this point. I also think I have the multitude of different experiences that come with that. So I have a master's degree in public health. I've worked in small towns, I've worked in big towns, I've worked for the state. I have a variety of experience other than just working here in Norwood. So I can sort of see what works in other areas. potentially bring that into Norwood, see what works in Norwood that we can bring out to other places. So that's sort of the major thing that differentiates me from her.
Gotcha. Okay. So also, I was looking through your website a little bit, and I noticed that one of the aspects of your platform is updating past regulations. I was wondering if you had any examples of past regulations that you thought could use updating.
Yeah, my absolute favorite is from 1957, which requires that all sinks in a kitchen or other food prep area have a garbage disposal. That probably made a lot of sense back in the day when it was a newer technology and it would help divert food scraps from the waste. And that's something that we're still looking at today in terms of the cost to take care of our trash is increasing, and anything that we can do to divert food or other items out of the waste stream is appropriate. So at the time, garbage disposals was the way to do it. Unfortunately, with the building of the new middle school, they actually had a situation where the sink that they were trying to make ADA compliant didn't have space for a garbage disposal. So that paused that part of the building process. They had to go to the Board of Health to get a variance. Honestly, I think everybody involved was a little confused about why they needed to go through this step, as it's a Norwood-specific regulation. And I don't know if that's necessarily, do we need to require that by regulation? If people want to have one, that's great, they can have one, but do we need to require it and then potentially have situations like with the middle school that then delays building or gets in the way of other progress?
Gotcha. And also, I'm curious to see if there's any new regulations that you would like to see and not enforced but implemented by the Board of Health. And also maybe another example of past regulations that you'd like to see updated.
So I think in terms of new regulations, I'm always open to the idea of looking to see what's impacting the town and do we need regulation. The one thing that comes to mind is the regulation of kratom, which has the nickname gas station heroin. It's an opioid-like natural product, although they all still have synthetic options as well. It's sold in gas stations in town. You can just go in, buy it, and potentially become very addicted to it. And it has a host of negative side effects. It's not regulated at the federal or state level currently. I think that's being looked at potentially at the state level. Canton last year passed a regulation to ban it, and Denham is currently looking at that right now. And what I found interesting with Denham as well is their regulations are posted right now in draft form, and there's a public comment period, and they're going to have a public hearing. And I think that feedback is important because you might think, I know what's going to be appropriate and good for the town, but there might be some sort of downstream effect that you didn't think of as you were writing that regulation. And that's why, I mean, across the board, in all of the times that I've worked with regulations, there's always been an opportunity to have some sort of public input. And to the best of my knowledge, I don't think I've seen that occur here.
And that kind of leads, I'd like to dive into that more, but it doesn't lead to a question I'll ask later, which is another part of your platform. It seems to be communication from the town to Norwood residents. But I want to stick with that because there's something that I'm personally am interested in. So you said, what's the pronunciation of that heroin-like substance?
It can be pronounced a couple different ways. The one I've used most is kratom.
Kratom, and that's in what form is that sold in gas stations? Like, what is it? Is it sold through a certain product? I'm just curious.
Yeah, so I mean to go to the local establishments that sell this in Norwood just to see what forms they, and it comes in a variety of different forms and comes in a liquid form, I believe. You can buy it as a powder, as a capsule. So it sort of depends on where you get it from. But it can be purchased in a variety of different ways. And I think the ways that I've seen it most are powdered or liquid.
Gotcha. And in terms of maybe on a broader scale, is the regulations on such similar issues, does the local take precedent if the state doesn't already have enforcement? Or,
yes.
So it does, okay. So it's possible for local municipalities to set regulations if the state hasn't already adopted such regulations.
Correct. So if the state has a regulation that basically the locals will follow what the state does, or for example, the state has regulations around the food code. So all of the restaurant inspections that are done pursuant to the food code or the housing code. That's all done at the state level. But if the state doesn't speak to a certain topic and the town would like to. Massachusetts is rather unique like that, where the locals have a lot of control over what they do within their borders.
That is pretty unique, and I'll have to look into that more, but it was just a curious side note. Also, let's go into the communication aspect. So what would you propose if elected to the Board of Health? What changes? What changes would you propose?
I think, generally speaking, there just needs to be more communication. I would also say better communication, but more communication would be better communication. This is an issue town-wide. I think there's a real lack of timely and actionable information that comes out of the town. I think they're trying to do their best. But as an example, the Sharon Health Department has a monthly newsletter that gets sent out to anybody who wants to be on this newsletter list. It's really comprehensive. It covers a lot of different things. It covers events. It covers, hey, we're in spring. Here's some things to think about in terms of allergies or ticks or other relevant timely issues that might be impacting the town. And it's a lot of work to put something like that together.
Right.
But there's so much that our health department does that most people just have no idea. It's not something that will cross their mind or cross through their lives. Which is unfortunate because there's a lot of services that I think if more people were aware of them, people would use them. I had a couple of neighbors of mine ask, hey, I'm taking a new medication now that requires a syringe and I need to dispose of this safely. How do I do that? Can I take it to a pharmacy? It's, oh, the health department sells those containers.
Right.
The little one's $1 and the big one's $3, and then they'll take it when it's full. And they're like, really? And so that's a service that's been in existence for many, many years.
Yeah. So I guess I'm just thinking, so it would maybe be the implementation of a newsletter in town and just more usage of social media.
And also just other ways to get messages out about what's being used. I do know that I believe the town changed their social media policy so that it was just the one town Facebook, for instance,
Right.
and all the messages come out through there. Is there a way to connect with that one town Facebook in order to use that a little bit more effectively for not just town activities, which is what it's used most for right now, but for for some reason the rec department has their own Facebook group still. So, but like the senior center, they do a lot. The senior center has a newsletter. Can we look to see what's done with other departments and see what's worked, mimic that, and then just continue the PR campaign essentially.
Gotcha. So I'd like to pivot now to something that I've been noticing. It seems like mental health has been something that has kind of really come to the spotlight in the past few years, not even on a local stage, but national, if not international. I'm curious if there's anything that you would like to see done differently about the town's measures to talk about and to handle mental health.
I would love there to just be a larger discussion as a whole for mental health. I think the town is doing a decent job right now, but I think there's also ways to improve. There was a grant that was given to the town for mental health awareness training and mental health first aid, and that got a number of the town employees trained to identify is somebody going through a potential mental health challenge, the difference between a challenge, which we all have, and crisis, which requires a little bit more work, and then how to connect somebody to that care. I had the ability to actually take that training, and it was really valuable. And it was useful just to see the number of things that could occur to someone at any point in their life, or how do you sort of identify, this doesn't seem right, this seems a little off. And the hardest part of that class was being able to ask somebody, hey, are you thinking about committing suicide? And that was something that all of us in the class really had a difficult time with at first. And then the more you did it, the more you sort of were like, oh, this is a question to ask. I don't have to feel any sort of like shame or stigma around it. And I think that's really important. That grant unfortunately ends at the end of this year. So we'll lose one of those trainers. But I'd like to see more of that occur if possible. I would have loved to see more of the community involvement in that. I think they were very focused on let's get the town staff trained, which great, but it would be wonderful if we could get more residents involved, more businesses involved. I believe they did a training at the high school recently to train the teens on sort of mental health awareness for teens, and that was received really well. So let's do more of that on a routine basis, because gosh, our teens are going through a lot, I'm sure.
So you mentioned something there. I was thinking about mentioning it later, but I would think it's a good transition now. Grant programs. The health department has a decent amount of positions funded through grants, and it is not expected that these positions would be funded by these grants going forward. So I'm curious, as a member of the Board of Health, if elected, would you support using town funds of some sort to maintain these positions?
Yeah, that's a fantastic question, especially with the number of budget issues that the town is facing over the next couple of years. We would have to really look hard at it. It's not something that I would say, yes, absolutely, the town should fund this. There are going to be some tough decisions that are made in the next couple of years, and we could have a really good justification for a program and have really difficult funding situation and not be able to fund a program. But I would also support, and one of the things that I'm running on as well, is where else could we look for money that isn't the town? And the two main areas that I've identified so far are use of the Norfolk County 8 shared service arrangement, which is money that comes from the state to assist Norwood and 6 other communities. Despite the name, it's sort of like Big Ten doesn't have 10 teams anymore. The Norfolk County 8 doesn't have 8 towns anymore, used to. And
I believe it's 7 now.
It's 7 now, correct. And that includes towns like Denham and Canton and Westwood and Walpole. So we can really use our neighbors to be able to say, here's what works. And so we can use that money. That's where we have the regional positions, a regional epidemiologist. I believe they were hoping to have a regional nurse in that position, was unable to be filled. So they're trying to fill that one as well. And we can use the programs on a larger scale. So it doesn't make sense for Norwood necessarily to hire an epidemiologist. The work that they would do just for Norwood probably isn't enough to justify that FTE position. But if that person is then working for multiple towns and sort of helping out across the board, and none of the towns need to pay out of their budget for that position, then that makes sense. You get the service without having to pay the actual impact out of it from the budget.
And unfortunately, it does turn out, though, that position, the regional pronounce my bad pronunciation.
No worries.
Epidemiologist,
yep.
is actually funded by grants as well.
Yes.
Through the regional 8 or 7 now. So I guess that would be something else that the town would have to maybe look at a regional basis and sharing that cost, or just getting rid of that position altogether.
Exactly, and that one also, I think there's some questions up in the air because it's a state-funded grant. That particular grant might go away, but if the state feels, hey, that's a worthwhile program to continue to have, it may evolve, it may exist in a different form, it might go away altogether, but there are different options that we can see what's available at that point.
All right, so this is a big pivot, and it's something I questioned if I should include today, but it's actually about the situation. It was roughly two years ago, just under 2 years ago, in which the Board of Health basically, I don't want to say shut down, but basically asked a boy to no longer operate his homemade ice cream stand. And I was curious, if you were a member of the Board of Health during that time, would you have approached that differently?
So I don't know the exact specifics about what exactly happened when. And so I can't say for certain I would have done something completely different or very different. But the impression that I received as someone just watching this unfold on social media was that there was a little bit of miscommunication that probably could have been handled a little bit better. And also, this is where going back to sort of just better communication takes place. This is a really good example to have more of that available to the public, because I think people, and I did see on social media, we're seeing, boy sells ice cream and saying, well, how is that any different from a lemonade stand, which we all see during the summertime and really appreciate on a hot day. And there is a difference, and ice cream is a time and temperature controlled product, lemonade isn't. And I remember having conversations with people about why that's the case, and it's a dairy product, and otherwise just saying it just is. There are certain foods that need to be kept under certain temperatures in order for it to be safe. The fact that it was like a homemade ice cream, I think.
It was homemade ice cream.
Right, so that brings in another area of you can sell food that you make in your kitchen, but you need to have a special license in order to do that. Your kitchen has to be inspected in order to meet the food code that's run by the state. And so there's a lot of, I think people will say, oh, I think it's okay, and I'm just gonna do it kind of a thing. And then when they're told no, maybe the reasoning isn't being given in the appropriate way. I think things escalated way out of hand, and it probably could have been resolved before things got totally out of control. But again, I wasn't there, and I didn't see exactly what occurred. So.
Yeah, I remember it was a national item. It was something that I believe Town Hall got a lot of calls about.
Yes.
For a prolonged time. So it's a national issue, not super national, but it was definitely on the spotlight a little bit. Okay, so another thing on your website was the reestablishment of pre-COVID programs. I was curious if you had any examples of a pre-COVID program that was discontinued that you would like to see established today.
So when I initially ran last year, there hadn't really been any of the school or community-based sort of pre-COVID programs coming back. Since then, the health department has worked to try to bring some of those back. So one example was having a dentist come in to the school and do an exam of kids and then have free or low-cost referrals to their program. The dentist they brought in for that, I think, wasn't getting the referrals that they were expecting to get from that program. So for them, taking that time out of their clinic practice didn't end up making sense. So I don't know if there is a plan to sort of get somebody else back at that point, but dental health is extraordinarily important to overall health and well-being. So if we can catch that early, that'd be wonderful. And another example would be sort of more involved eye screenings. The school nurse will do an eye screening for kids, and it's just a very basic, look at this, tell me what you see. But that's the extent of the screenings that they do. And I do know there's a local optometrist who potentially would be interested in that connection between how well can people see, or how well can kids see, and sort of their overall behavior development as well. So if you are having a hard time seeing at school, that might lead to more issues in terms of your overall behavior because you're having a hard time or your learning might suffer a little bit. So if you're able to find that, correct that, and I think this particular optometrist is really interested in that as a field as well. So I'd love to try to connect with them and try to see if there's a way to get that involved in the schools as well.
Gotcha. So that kind of relates to perhaps structural changes within the health department in Town Hall. I'm curious, or even public nurses in schools, would you support maybe any structural changes in how services are carried out rather than policies themselves, but mainly the structural changes in carrying out those policies?
By and large, I think most of the structure of the health department in Town Hall makes sense. There are 2 sanitarians who go out and do the restaurant inspections, the pool inspections, the camp inspections, that sort of thing. We have a public health nurse who does a lot of the disease investigation and other nursing adjacent blood pressure clinics, vaccines, and the like. I would like there to be more of a connection with the school nurses. That's not really a structural change.
Yeah.
The school nurses would still be in the schools, obviously. But I think there could be ways in which we could have a better connection between our public health nurse and the school nurses, see what they need. Is there a way that we could do a vaccine clinic or something else like that? Working together with dental and eye screenings, is there a way to give that extra support to the school nurses who, anybody who's been with a school nurse, they do a remarkable job every single day. And they do a lot with not very much. So any way that we can support them, I'm in favor of.
Sure. So with that, I've covered everything I wanted to talk about and I thought was relevant for the discussion. And I'm curious if there's anything that you would like to bring up to anybody who might be watching.
Sure. Well, the first thing is just in terms of funding for where we're going to find money for different programs and services. One other area would be the opioid settlement fund. And that's money that is coming into the state. I think it's coming in until 2030 36 or 7 or thereabouts, possibly even slightly longer. It's definitely late 2030s.
Yeah.
And that's something that Norwood is getting a little bit of money every year. I have had a really difficult time finding out where we're spending that money and how much money we're getting and where it's going from. It came before town meeting a couple of years ago, just to establish the fact that we were going to get that money and it was going to go into like the general health department fund.
Was it specifically the general health department fund or just the general fund?
You know, I think it was to be used by the health department. Someone else has asked me this question. I need to go back and look at the warrant again. But it was specifically for, let's accept this money so that we can use it, essentially. And I don't know why. I've asked different people in town and town hall, like, how much are we spending? What are we spending it on? I've had a really difficult time getting this information from the town. And recently, as I was writing my League of Women Voters statement a couple of weeks ago, the state released a dashboard which shows how much money is going to each municipality and what are they spending it on and how much are they spending. And so far, everything that's being spent by Norwood makes sense. It's the Interface Mental Health Hotline, it's Narcan, it's the last Board of Health meeting that was in February. They had boxes that included the face mask and Narcan so that if somebody was overdosing in public, you've got the ability to try to save their life right there. And that's all great, but there's still other money that hasn't been used, and I don't know what the process is to start to spend some of that money. And on the Impact Norwood Steering Committee, we're trying to have that discussion of, okay, this grant ends next year, and we know we're not going to expect the town necessarily to foot the bill entirely, and we're looking for potential avenues. And one of those avenues to me, which makes perfect sense, would be opioid settlement funds. And for some reason, that just is a non-starter, and I don't quite understand why.
Gotcha. So is there anything else, or should we close?
Just the one other thing is, when I ran last year, the number one question I got from people was Norwood Hospital.
Oh, okay, yeah, sure. So actually, that's a good question. Sorry, I cut you off.
No, continue.
Do you believe that the Board of Health has a role in bringing back our hospital?
Right now?
Yeah.
No. I don't think there's anything that the Board of Health can do that will magically help bring the hospital back. It is my understanding that right now we need an operator for the hospital. And if I knew then what I know now in terms of just how long this process would have been, I initially approached the town manager a few years ago of, wouldn't it be cool if Norwood owned the hospital? Wouldn't it be cool if we had a municipal run collective hospital of Norwood and the surrounding communities? This is something that's done in other parts of the country.
What was his response? I'm curious.
The response at the time was, that's going to take too long. We need a hospital now, and we need an experienced operator, which at the time made total sense. We don't know how to run a hospital. It would have taken a lot of time to try to set that up and get into a position where we would. And if the answer was, or we can go to an experienced hospital operator and they can be here a lot faster, yeah, we should have whatever is going to get the hospital here the fastest. Unfortunately, that then took a lot longer than I think anybody thought it was going to end up taking. But there's not a lot that any one person or just the Board of Health in general is able to do until we get that operator. And that's something that I know residents are extraordinarily frustrated. I'm extraordinarily frustrated. I know that we have a task force. I'm not entirely sure what action the task force is doing. That it feels like the last time I heard what the task force was up to was over a year ago when we had the meeting up at the high school about where things were and what the next steps were going to be. And the Board of Health was all there, but they didn't say anything during that meeting because I don't think there was anything for them to say. But once we do get an operator, that's the point at which I think we should be directing people to start writing those letters that we've been told to do for the last several years. But I don't think they're doing anything right now. And I think it makes sense to sort of have a more strategic approach and say, let's wait until the state can actually do something. I know Michael Saad at the League of Women Voters Net was like, the governor needs to do this. The governor's not going to run this hospital. The governor isn't able to come in and magically produce an operator for us. I think we can all agree, I don't think I want the governor herself operating this hospital either. But once we actually do have an operator in place, then we can have some meaningful action by the town to really say, hey, Norwood needs this hospital. Not just Norwood, the surrounding community really needs this hospital. So I would have liked to have a little bit more of a strategic approach, perhaps, but perhaps the strategy's just been evolving over time. But it would have been nice to know, even if there's nothing they can say now, like we're still in negotiations, that those can't be public, okay, but at least that's where we still are in the process.
Gotcha. Well, Kathryn, thank you very much for coming and speaking, and good luck on Election Day.
Thank you.
Thank you for watching. Just a reminder, the Board of Selectmen debate will be at 5 p.m. on March 31st live, so stay tuned for that. Thank you for watching, and I'll see you next time.